News 3 is taking action for your health. Tonight, we are taking a closer look at the COVID-19 rollout, COVID-19 vaccine rollout in Virginia. And we're asking questions that you want to know. What's working? What are the challenges? And where do we go from here?
Now, to date, Virginia has given out about 1.3 million vaccines. We are hearing a lot of questions from our TV viewers and our online communities surrounding the vaccine and the rollout. So we have brought in some experts to help answer your questions.
Dr. Danny Avula is with the Virginia Department of Health. He is in charge of the vaccine rollout for the entire state. And Dr. Edward Oldfield is an infectious disease specialist with Eastern Virginia Medical School.
I want to thank both of you for joining us this afternoon. So, Dr. Avula, I know you want to start first with where we are exactly in this vaccine rollout and the new statewide pre-registration system that kicks off tomorrow.
Yeah, thanks so much. So, we're about 7 weeks into the vaccine rollout and have vaccinated at this point over 1.3 million doses that have gone out. And that has ramped up really rapidly. It's been, I came into this role the first week of January, and it has been amazing to see how much capacity has built up around our state between our health departments, our health systems, private providers and pharmacies who are all getting doses out. At some point early on, we set a goal of getting to 50,000 doses a day because we knew that's what we were going to need to get to try to vaccinate all of Virginia by the summer. And there have been multiple days where we have vaccinated more than 50,000 individuals in a single day. So the capacity to vaccinate has built up very quickly. We're able to meet our goal, except for the reality that we don't have enough vaccine coming into Virginia each week. We are getting about 130,000 new doses. And when you start to split that up community by community, you see that that's really only a few thousand doses per locality. And so we're a long way from needing to be where we want to be in terms of the amount of vaccine that's coming in. But as soon as it comes in, we've got the ability to get it out, which is really encouraging.
All right, thank you so much for that opening statement, Dr. Avula. It may have answered some questions, but we have many more. News 3 viewers have sent in a number of questions and their concerns over the past few days.
That's right, Barbara. And the first one goes to Dr. Oldfield. Now, we have gotten several questions along these lines. Betty in Chesapeake wants to know if you should take the vaccine if you have a lung condition like COPD or emphysema. Dr. Oldfield?
Yes, I think that that's a comorbidity that has actually an increased risk of severe disease. So people with chronic lung disease definitely should get the vaccine. This is it's a killed part of the virus. There's no whole virus. There's nothing to get into your nucleus where your DNA is. It's just simply that little spike protein that your body sees and makes an immune response. But people with diabetes, chronic lung disease, those are the people that really need to get the vaccine.
All right, understood. Thank you, Dr. Oldfield. We appreciate that. Now let's move on to our next question.
Oh, this is from a viewer in North Carolina. Now, they didn't want to provide their name on television, but here is her concern. She says, I got sick after the first shot, very weak and tired and a sick stomach. She wants to know, should I take the second one? She says she's 79. She says in her 20s, she had a very bad reaction to a flu shot, but has since taken that with no issues. Dr. Avula, why don't you take this one?
Sure. So, whenever we introduce a vaccine to the body, what we're doing is revving up our immune system, and our immune system is responding to the vaccine. It's creating the protection that our bodies need by making antibodies, and invariably that's going to cause some type of reaction. And about 10% of the population who have received this COVID vaccine have some kind of side effect, whether that's malaise, maybe a slight fever for a day, certainly pain at the site of injection, and then a small percentage, less than 1%, will have more severe symptoms. So we know that is the case anytime your immune system is responding to a protein. I think in this particular case, I would really talk it through with your provider, make sure they understand the symptoms that you had with your first dose, and then they will be able to help you make a decision about that second dose. Really, at this point, anything but a very severe allergic reaction to the first dose, really we would encourage the second dose. And I don't know if Dr. Oldfield has other thoughts or anything to add to that.
No, I would agree. The way I think about these side effects is this is your body reacting to the vaccine, making protection for you if it ever sees the real virus. So that's the way I think about that sore arm or any other side effect. And I certainly would not hesitate to get the second dose. There is some suggestion that the second dose may have more side effects than the first. For me, actually, the second dose was less of a problem than the first. And people under 50 or 60 have more side effects than those over. So I think it's just that immune system reacting, and that's what you're feeling, which is good.
Good information from both of you. Thank you. Now, we're getting a lot of questions about potential side effects.
Yeah, and to that point, our crews came across this next question while out in the field covering a story. Let's take a listen.
My question would be, what are the side effects of the vaccine? Because, I mean, in my case, I have an autoimmune disorder. So, I mean, if I got COVID, I'm pretty much toast. But then on the other hand, I want to know, what are the any complications from getting the vaccine so I could make a better and informed decision.
There's clearly there she's asking about autoimmune disorder. Dr. Oldfield, what's your take on that?
Yeah, there's no problem whatsoever with people with autoimmune disorders taking the vaccine. And that's another group that has worse outcomes. And so they need the vaccine even more. And so I would definitely go ahead and get it if I had an autoimmune disorder.
Thank you, Dr. Oldfield. Thanks to both of you. More of your questions and answers from our doctors straight ahead after the break.
We are sharing your questions about the vaccine rollout with Dr. Danny Avula with the Virginia Department of Health and Dr. Edward Oldfield with Eastern Virginia Medical School.
Now, we've been hearing a lot about the side effects of these vaccines. We're talking about the Moderna and the Pfizer vaccine. People report body aches, fever, chills, and you all have addressed some of those. Are the side effects different depending on which vaccine you get, Dr. Avula?
No, we see the same spectrum of side effects in both the Moderna and the Pfizer vaccines, and we're seeing similar things in the early data from some of the vaccines that are coming down the pike as well. So not a real difference in the side effect profile for what's out there right now.
All right, thanks, Dr. Avula. Let's move on to our next question.
Now, this one, Beverly, is from Pamela in Virginia Beach, and she wants to find out how to get a vaccine for her husband who is homebound. Now, here's what she says. He has trouble walking and does not drive. He can't stand for a very long time or walk very far. He has health issues. So far, we have signed up at VB 311, and I go in each day at CVS and Walgreens, but no appointment is available. Is it possible to get a traveling nurse to administer the vaccine? That is the question. Now, Dr. Avula, any plans, any plan in place to accommodate homebound patients?
Yeah, now that we have moved fully into 1B as a state, there's a lot of work being done to figure out how do we get vaccine out to patients like your husband that may not be able to, get to a mass vaccination event, wouldn't be able to stand for long periods of time. So right now we are working with the state agency that administers the Medicaid program to identify some of those individuals who are homebound, who have a personal care system, and who have a transportation benefit. And we're working to direct vaccine to that segment of the population, but there are other homebound individuals who don't qualify for those. So I think the most effective way to do that right now is to make sure that your local health department knows the specifics of your situation. In some ways, being homebound is limits your exposure because you're not out and about and aren't going to see as many people and potentially contract COVID. But obviously, if there are others in the house who may be, we'll just need to continue social distancing and masking to the degree possible until we have the ability to send folks out and do these mobile vaccinations. There are some logistical challenges, right? Because the vaccine comes in a vial, and if you don't have it all planned out where you've got 10 people that you can vaccinate in a couple hour period, you potentially risk wasting some of the doses in that vial. And so we're working through different options right now, but please get in touch with your local health department.
Thanks, Dr. Avula. Now, our next video viewer question is for Dr. Oldfield. It's from Tia in Norfolk about an underlying condition. Let's listen and you can respond on the other side.
I'll ask, is the vaccines really working? Like, I have asthma myself, so I'm really cautious on what am I going to take and is it really working?
Yeah, both of these vaccines are extraordinarily protective. 95% prevention of any symptoms with a COVID infection. And it's close to 100% in preventing people that get infected from being hospitalized. And so in the studies of these two vaccines, there were 30,000 people that got the vaccine and nobody got hospitalized or died who got the vaccine. So if I had asthma, I would definitely want to get this vaccine with that high 95% protection and 100% essentially protection from ending up in the hospital if you get COVID.
Okay. Well, thank you, doctor. Stay with us as we take more of your questions about the vaccine rollout. We're back on the other side of the break.
From the JES First Warning Weather Center, here's Chief Meteorologist Patrick Rocky.
Hey, we'll be back with your COVID vaccine questions in just a moment, but we want to get you caught up on the weather, and that weather may include some storms overnight, and a few of those storms could be on the strong to severe side. The prime time for that's going to be between, say, 1 a.m. and 4 a.m. By the time most of us wake up, storms will be gone. We'll just be left with some rain around, and get this, tomorrow is going to be warm and windy with high temperatures in the 60s. Most of us have only been in the low 40s today, but we've got whiplash weather on the way. We're talking 60s and for highs, 50s, 40s, and high temperatures in the 30s on the way. So tomorrow's our warm day, mid 60s. Upper 30s and low 40s by Wednesday. We're back in the 50s for Thursday and Friday, and then back in the upper 30s on Saturday. It is still February after all. So why the big swings in temperatures? Well, first we've got a warm front that's going to be moving in. Then shortly behind that, a cold front. Right in between those, you can see that line of storms. That's what's going to be moving in our direction overnight. Right now, things are quiet. We've got fog and mist and drizzle out there, but no heavy downpours falling. And we don't really expect any downpours over the next couple of hours. Late this evening, we could see those. Then as we head toward 1 o'clock in the morning, you see that line of storms moving in. Should move in and out pretty quickly. And by the time we wake up tomorrow morning, there we are at 7 a.m. We have a few showers around, but most of the rain will be gone. The storms will be gone, and even sunshine breaking out as we head through the day. It's going to be a warm and windy one for tomorrow. Again, most of us will have highs in the 60s, but then the cold front moves in, winds flip around to the north, and temperatures drop like a rock as we head into Wednesday. Late in the day on Wednesday, some clouds start to roll back in ahead of our next weather maker, and that is going to bring us even more rain. So our forecast for this evening, we expect temperatures in the low to mid 40s. Yeah, there will be some showers, especially as we head toward late in the evening hours, and then those storms roll in overnight. Again, some of those could be on the strong to severe side. The best or worst bet for wet weather is going to be across eastern North Carolina, level 1 out of 5 from the Storm Prediction Center. So strong gusty winds, a possibility. Also a very slight chance we could have an isolated tornado. So obviously something we're going to be watching very closely. When we wake up tomorrow morning, it is going to be much milder than when you go to bed tonight. Temperatures in the upper 50s, lower 60s, a few lingering showers, but by the afternoon, look at this, we've got sunshine breaking out. Our old friend, we haven't seen you in a while. Temperatures tomorrow in the low to mid 60s, some of us maybe even into the upper 60s for high temperatures. So here's our 3-day forecast. You can check it out anytime online at WTKR.com, and you see the big swing in temperatures from the mid 60s on Tuesday, the upper 30s and lower 40s as we head toward Wednesday. Then we rebound into the 50s on Thursday and Friday. A good chance for showers, widespread rain and wind on Thursday. Some morning showers on Friday before we dry out. And could it be? Yeah, we've got 2 straight days with no rain, and they fall on the weekend on Saturday and Sunday. But never fear if you're a fan of the rain. It makes a comeback as we head toward next Monday.
And News 3 is taking action for your health. Tonight, we are answering your questions about the vaccine rollout in Virginia.
What's working? What are the challenges? And your questions about things like side effects and issues with registration. So we have brought in some experts to help answer your questions.
Dr. Danny Avula is with the Virginia Department of Health, and he is in charge of the vaccine rollout for the entire state. Dr. Edward Oldfield is an infectious disease specialist with Eastern Virginia Medical School.
So we have a great question here from Amy in Hampton. If you have had COVID, does your body make the antibodies? And if so, would these antibodies be similar to the antibodies created by taking the COVID vaccine? Do people who have recovered from COVID need to get the COVID vaccine? Dr. Oldfield.
Yes, so if you have COVID, your body does make antibodies, and you are protected to some extent for maybe 3 months or more, but it's not nearly as potent a protective response as the vaccine. The vaccine is much stronger in developing your immune system than an infection. So you can certainly get the vaccine if you've had COVID. Some people are suggesting maybe to wait about 3 months because you should be protected by your COVID infection for 3 months. Then if you got it too close to your COVID infection, you might have a more significant reaction to the vaccine.
Okay, Dr. Oldfield, thank you so much. Now, our next question has to do with a missed appointment.
Now, this one is from Lee Ann in Norfolk. She said her mom didn't check her email before bed and got a Virginia Department of Health email for an appointment window the next day, so she missed it. Is there a way to sign back up and get a new window if you miss it? Dr. Avula.
So I would start by going back to the pre-registration. I think the unfortunate part is now that you'll be at the back of the line, but I do think if you make sure you're back in line and then specifically reach out to your health department and see if there's any way they can honor the appointment that you missed, they could slot you into an earlier clinic. It really is just going to depend health department by health department how they would handle a missed appointment.
Dr. Avula, thank you. Now, this question is also for you from Carrie in Virginia Beach. We know that people are double booking appointments and may not show up for scheduled appointments. What happens to the vaccines that have been thawed out but not used? Are they thrown away? And how is that being tracked?
We are trying to minimize waste as much as possible. And so most clinics have a wait list policy where they will run through a list of people that they've got on a wait list to make sure that they can come at the end of the day and get those doses used and not wasted. We do have a wastage policy as well as the CDC, and some degree of waste is going to happen. This is a very fragile vaccine. For example, if you were to shake a vial or accidentally drop a vial, the manufacturer guidance is that has to go to waste. And then, as I said earlier, each vial for Pfizer has 6 doses, for Moderna has 10 doses. And if you get to the end of a clinic and aren't able to use that immediately, that could potentially go to waste as well. Obviously, we want to minimize that as much as possible. So most places have a wait list in place where they call down that list as soon as they know that they have no-shows in a given day.
All right, this next viewer wants to be anonymous. What is the risk of taking the vaccine if you are HIV positive? Dr. Oldfield.
So if you're HIV positive, since this is not a live virus, this is a messenger RNA vaccine. And basically, you think of messenger RNA as a recipe for your cell. It tells your cells how to make what the messenger RNA is programmed to do. And in this case, it's just the tiny little spike on the virus. That's all. Not the whole virus, just that tiny little spike. And then your cell sees the spike and makes an immune response. For HIV patients, if your CD4 count's over 200, I would suspect you would have a completely normal response to this vaccine and be 95% protected. If you have a very low CD4 count, it's probably not going to work as well, but it certainly can't harm you. There's some data that suggests that people with HIV have a slightly more serious disease. There's other data that says that people with HIV do about as well as people that don't have HIV. But I would certainly get the vaccine if I had HIV, and I wouldn't worry about it at all.
All right, thank you, Doctor. Now, Dr. Avula, let's talk more about the registration. There are so many questions about why there's such a backup.
The reason for the backup is that we don't have enough vaccine, right? So right now, when you consider the fact that all of Virginia is in phase 1B, the population of 1A and 1B that's eligible across the state is almost 50% of Virginians. So almost 4 million plus people, but we're only getting 130,000 new doses a day. So we actually have been very efficient in getting our doses out. We're above 90% of all first doses that come in go out almost immediately. But the problem is there just isn't enough vaccine to go around. And so what is happening is people pre-register for vaccination is that they are getting on a wait list, and health departments and other providers are working through that list as quickly as possible, stratifying by risk. So they'll take their 65 and overs, and about half of the vaccine that comes into a community is going to the elderly population. And then with the other half, they're really working through those essential worker tiers.
Dr. Avola, is there a chance that we may be seeing more vaccine coming into each individual state other than what we're getting right now?
Yeah, so we've seen small increases in our weekly allocation. About 3 weeks ago, it was 105,000 doses for the entire week. This week, it was 130,000 doses a week. And there's a couple of other ways that we're bringing vaccine into the state of Virginia. Last week, we activated something called Part 2 of the Federal Pharmacy Partnership. And so CVS, as the first pharmacy, but many other pharmacies will come behind over the next few weeks, are able to tap into a separate federal allocation. So 26,000 new doses a week above and beyond our 130 started this past Friday. In addition, the federal government has a separate allocation for a category of clinics called federally qualified health centers. So there are a handful of FQHCs scattered throughout the state, and we will be, probably next week, we'll start to see new doses coming into FQHCs above and beyond our 130,000. In addition to all of that, the administration's commitment to purchasing more vaccines from Moderna and Pfizer, and then new vaccines coming on the scene. So Johnson & Johnson has submitted for their authorization. We expect that decision to be made on February 26th. And if the data looks good, we could see that vaccine coming into Virginia as early as the first week of March. AstraZeneca, another vaccine candidate that's used in many, many countries around the world, would likely be a month behind. So there are some prospects for increased doses in the next month to 2 months.
All right. Thank you, Doctor. More of your questions and answers for our doctors straight ahead on the other side of the break on News 3 at 6.